Well, I am in Colonial Williamsburg today, and I want to talk to you about how Colonial Williamsburg and your Medicare insurance actually have something in common. As you know, or hopefully you know, here at this colonial capital in Williamsburg, Virginia, that a number of our founding fathers actually came here and they discussed things like self-government and freedom and liberty. And those are important to your Medicare and to your health care. Virginians like Peyton Randolph, George Washington, Thomas Jefferson, and Patrick Henry, where right there he gave his famous Stamp Act speech in protest to the Stamp Act that the English had put upon the colonies. So our founding fathers, the concept of self-government and freedom were extremely important. And how this ties in to your Medicare is being self-governed. It is not relying on the government to take care of you. Yes, the government does provide Medicare coverage, either through Original Medicare or Medicare Advantage, but it is up to you to take care of your health. And that is something our founding fathers would have absolutely supported.
Care for the aged and infirm is a duty of every just society, but such powers have not been granted to the federal government. Let the states and communities provide for their own, lest we surrender liberty to the overreach of centralized authority.
Virginia will take up that charge, Mr. Jefferson.
And so the things that you can do to be more self-governed for your health care and not relying on the government is obviously living a good lifestyle, eating properly, exercising properly.
Down and hold. Ready up?
It's heavier than a bale of tobacco.
That means we're working.
You two look like you're staging a revolt against gravity.
All right, gentlemen, push-ups together now.
One more for liberty.
How's the pace, General?
Strong. Keep it steady.
Sun's rising on a free country, boys.
Let's make sure we can keep up with it.
And of course, having the proper mindset. So the concept of self-government is very important when it comes to your health care. What you have to realize is Medicare is not health care. They don't take care of your health. What they do is they provide insurance and protection in the event that you have bills to pay to providers. That is the purpose of Medicare. It's not to tell you how to take care of your health. It's not really to protect your health. It is to protect your assets and your income in the event that you have large medical bills. Also, the idea of freedom, the freedom to choose. What our founding fathers wanted was the freedom to choose their own government and their own elected representatives. And you should have the freedom to choose your Medicare, whether you want Original Medicare plus a drug plan plus a supplement, or whether you want Medicare Advantage and what type of Medicare Advantage plan you have, or you don't want to take any Medicare at all. You have that right and you should be free to choose. You should know the consequences of those choices, and you should know the benefits of those choices as well. And unfortunately, many people don't. And one of the things I am quite confident of that our founding fathers would be opposed to is this part of Project 2025 that wants to mandate Medicare Advantage. Hopefully that doesn't go anywhere, and I've done some videos about that, but that is the mandate that the government is going to, by default, put everybody when they turn 65 onto a Medicare Advantage plan. That is totally contrary to what our founding fathers would believe and what they fought and they died for.
Members of this Congress, 2 centuries ago, we fought to secure a republic where government served the people, not the other way around. The mandate set forth in Project 2025, compelling our citizens into a single brand of private insurance, is no mere policy quarrel.
Thanks to gentlemen.
You should have the freedom to choose Medicare Advantage or not, or Original Medicare, however you want to do it. So I hope that you've enjoyed this history lesson today from Colonial Williamsburg. If you need help with your Medicare, then by all means, feel free to reach out to me. I'm Chris Brang, the Medicare Analyst. Make it a great day.